y'all, welcome to my channel. My name is Jory and I'm the Black Medical Anthropologist. Today's video is going to be podcast styled. I'm trying out different types of videos and I'd love some feedback on what you guys think. For this podcast, I'm going to delve into medical anthropology, relevant definitions, different cultural ideas of disease, and how it contributes to better public health outcomes. If you like this video, please like, share, and subscribe. Now let's jump right in. Simply put, anthropology is the study of humankind. Anthropologists try to gain a better understanding of the human experience through a non-judgmental lens. The most common research method is ethnography, a qualitative process of collecting data in which researchers immerse themselves in a particular culture. Anthropology consists of 4 separate fields: cultural, biological, archaeology, and linguistics. Medical anthropology is not a field of anthropology, but rather it encompasses multiple fields. It is the holistic study of health, disease, and healing, which includes cultural, biological, and linguistic elements. In order to understand medical anthropology, we must define its components. According to the World Health Organization, health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Disease refers to altered functions of the body that manifest as a distinctive group of symptoms. Lastly, healing is the most complicated word to define, as it can be rather subjective. Simply put, healing is the process of resolving disease and illness. To help create a better understanding, I'm going to use the example of epilepsy. In Western biomedicine, epilepsy is known to be a chronic disease of the brain that causes more than 2 unprovoked seizures. In our culture, having epilepsy is considered unhealthy and the patient must be healed. After diagnosing, healthcare providers investigate the cause of seizures in order to determine how to treat the patient. Epilepsy's cause is unknown in 1/3 of cases, but some common causes are brain tumors, alcohol withdrawal, and traumatic brain injuries. If the cause of the disease is determined, a specific treatment such as removing the tumor is implemented. If the cause is undetermined, or if a patient continues having seizures, we have medications for symptom management. Overall, people with epilepsy are considered healed or in remission when they have not had seizures for longer than 10 years, including 5 years off seizure medications. In summary, the disease is called epilepsy. Healing is done through treating the underlying cause or with medications, and one would be considered healed after not having seizures for 10 years. A contrast to the Western belief of epilepsy is that of Hmong people. Hmong beliefs about epilepsy were made popular due to the book The Spirit Catches You and You Fall Down by Anne Fadiman. The book is an ethnographic true story about physicians in Minnesota attempting to treat a child, Leah Lee, with epilepsy and the hardships that come with colliding cultures. Hmong people are mountain dwellers from China that have spread geographically due to political clashes. Though Hmong people have dispersed all over the world, many practices and beliefs are consistent in their culture. The novel discusses how Hmong people believe epilepsy is not a disease, but a spiritual affliction called Kwagdong Peg, which translates to "the spirit catches you." It is believed to be caused by an evil spirit called Adab attacking the soul. While it is known that this is dangerous, many Hmong people with Kwagdong Peg are praised and go on to be shamans because it is thought to be how they perceive things that other people cannot see. Because Kwagdong Peg is associated with shamanic powers, but it's also caused by an evil spirit, it is unclear whether it's considered healthy or unhealthy. In the novel, Leah's parents did not want her to completely stop having seizures, as they believed it made her noble. However, they did take her to the hospital, treat her with Hmong medicine, and sacrificed animals to rid of the spirit. If the affliction requires treatment, one could conclude that it's unhealthy to some capacity. Unfortunately, beyond the book, The Spirit Catches You and You Fall Down, there is little data about Kwagdong Peg. I was unable to find data about how it's considered healed. One could conclude that a shaman is healed, or at the least using their affliction for betterment through healing others. In the case of Leah, she would ultimately fall into a vegetative state due to brain damage caused by uncontrolled seizures and pass away. Again, to conclude, the disease is Kwagdong Peg. What is considered healthy is unclear, but may be gaining shamanic powers or when the seizures stop, and the healing practices are sacrificing animals and eating Hmong cultural foods. So beyond exploring the differences in concepts around health, disease, and healing, how does all this tie to medical anthropology? Well, Hmong immigration is the perfect example of cultures being less isolated. In 2018, immigrants made up 13% of the U.S. population. Even though our citizens have become more diverse, American health culture is still rather homogeneous. As many immigrants assimilate into American culture, researchers are observing its effects on their health. A 2016 study found that while naturalized and non-citizen immigrants have lower rates of chronic illnesses than U.S.-born adults, Immigrants who obtained citizenship had higher rates of type 2 diabetes. Another study discovered that at baseline, the health of immigrant children is initially determined by inheritance from their parents. However, this factor changes the longer they stay in the U.S. With each U.S.-born generation, the BMI of immigrant children grows higher and loses the resemblance of their mothers. Though it is hard to know for certain the exact cause of the decline in the health of immigrants, there are theories. The first researcher concluded that the decline is due to American lifestyle, lack of access to care, and aging, a risk factor for many chronic illnesses. I would also add that, as seen with the Lee family, when people from different cultural backgrounds do interact with the medical system, factors like low medical literacy and language barriers may contribute to poor outcomes. Not to mention a lack of cultural integration and competency within the medical system. People affected by these factors may not continue seeking care due to mistrust in Western healthcare. From my medical school experience, I remember a Black American patient who believed she could heal her cancer with herbal remedies and rituals. Her doctor told her the evidence indicates biomedicine interventions have proven efficacy and there was no proof her remedies would work. The patient, not feeling affirmed in her beliefs, was lost to follow-up. Some time later, she returned to the emergency department with a medical emergency due to the cancer spreading to her brain. Her cancer was declared terminal and with intervention that may have been preventable. My personal example and lack of findings on Quagdom-Peg demonstrate the lack of evidence for many healing traditions and beliefs that differ from Western biomedicine. There are customs that have been passed down for centuries that may work due to poorly understood biological processes or simply due to placebo effect. There are beliefs that may have merit but involve complex ideas that are hard to prove. Regardless, culture-specific healing practices and beliefs are valid, and populations may not have survived this long if they didn't offer some level of protection. Modern ethnomedicine has the goal of understanding these alternative medical or cultural beliefs to create the best outcomes for people foreign to biomedicine. Medical anthropologists research health culture and advocate for changes in healthcare. For example, Dr. Byron Good is a medical anthropologist involved in mental health research and advocacy in Indonesia. He created a pilot study to determine how culture influences certain aspects of early psychosis. He emphasizes the importance of understanding how culture, trauma, and society affect psychotic experience, and this data could potentially be used to improve patient mental health outcomes. Dr. Stella Yanzi has made contributions through her ethnographic research of the perspectives of Ugandan men regarding condom use and protecting women against HIV. This ethnography concluded that while men were worried about sexual safety of their partner, they were more concerned about maintaining control of Ugandan women. Dr. Yanzi advocates that to lower the rates of women contracting HIV, the nation must use education and social marketing in a way that creates male trust in the positive benefits of condom use. The marketing also needs to simultaneously address men's need for controlling women. As I researched influential medical anthropologists, it was very clear what value anthropology has in public health. Cultures are clashing in healthcare, increasing the need for intervention beyond medical expertise. In the case of Leah Lee, her family would deem her physicians incompetent and blame them for her passing. I can't help but wonder if an anthropologist could have provided cultural insight to relay to her doctors. Information that could have helped the healthcare team and patient come to a compromise while maintaining trust. Regarding the Black patient with cancer, a medical anthropologist could have helped train physicians on how to affirm and integrate patients' healing practices into their care instead of dismissing it. Anthropologists aim to have an objective lens when analyzing biomedicine, which creates a unique perspective that can improve equity. There is much to gain from understanding the nuances of beliefs around disease, health, and healing. Medical anthropology is a relatively new subcategory of anthropology that has already made its mark. I have faith that this trend will continue, and that I will too, as the Black medical anthropologist. Thank you so much for watching. What are your thoughts on medical anthropology? How does your culture contribute to how you experience the healthcare system? Leave a comment below. And don't forget, like, share, and subscribe. See you next video. Bye!